watch it and learn from these meetings. We are doing something a little differently tonight that we didn't do the last time around. We wish we were doing it in person, but we reached out to many of you, and what we heard from you are a couple of things. One, you wanted to hear from each other and hear how each of you are using your endowed chair. And so we're going to rotate all of you. It'll take a couple of years to rotate through, but we'll rotate all of you and have opportunities to hear from each of you each time. And we're also grateful to have Robert Braithwaite with us tonight to just share some high-level thoughts as to the vision and what's going on at Hoag, and also talk a little bit about the Endowed Chair Program. Want to welcome our two newest Endowed Chairholders. I don't know if I saw Dr. Karamardian on the call yet, but I can't see the full screen.
Yes.
So, oh,
yeah, I'm on the call.
I see Lisa's iPhone. There we go. Perfect. So Dr. Gary Ulaner, who's the James and Pamela Muzzy Endowed Chair in Molecular Imaging and Therapy. Grateful to have him with us. Joined Hoag in the fall of 2020 from Memorial Sloan Kettering Cancer Center, and was recruited to Hoag to develop the first and only molecular imaging and therapy program in Orange County, and has just really taken off from the get-go, and has been great working with us and working with our donors. So we're grateful to have him here. The goal is for Hoag to become a leading center for research and training in molecular imaging and therapy, and we'll be training a fellow. So many of you may not know this, but the Muzzy family also gave a recent gift. And Dr. Silverstein, you're the inspiration on this first one with your first fellowship. So we now have another fellowship from the Muzzy family that will be in Dr. Ulaner's area. So welcome, Dr. Ulaner, and congratulations on that new gift. And then our most recent, hopefully you all saw the announcement, Dr. Lisa Karamardian, who's the Jeffrey M. Carlton Endowed Chair in Women's Health in honor of Dr. Ann Kent. And I know this is special for Lisa to be the first recipient of this chair, honoring her colleague and mentor, Dr. Ann Kent, who was a leader in obstetrics and gynecology until her recent retirement. And again, the chair is made possible through a nice estate gift from the late Jeffrey M. Carlton. Dr. Karamardian has been an active member of Hoag since 1996, previously chair of the Department of Obstetrics and Gynecology at Hoag, and was a founding physician and president of Pacific Women's Healthcare Associates in Newport Beach. So where she is experienced in high-risk obstetrics, including multiple gestations and pregnancies, and also committed to minimally invasive surgical options to treat gynecologic conditions. So she has indicated she'll utilize resources to harness Hoag's supportive and caring environment into more personalized care for our patients. Welcome, Dr. Ulaner. Welcome, Dr. Karamardian. So thank you for being here with us this evening. And I also want to just mention, unfortunately, COVID has provided a backlog. This is a good problem to have, not because of COVID, but because we've really expanded our endowed chairs and our endowed chair holders. So we are still pushing to have our next investiture, and there are a number of you who have not attended an investiture. It is a great ceremony, and we just love this program that we've been able to bring to Hoag. So we pushed this one from the spring to the fall and now to the spring again. We're pushing to have the investiture for Dr. Skorab, Lewis, and Mila in the spring of 2022. I don't think we have a specific date, but we will update you when it's all confirmed. And I just want to take a couple of minutes just to give you some of the facts and figures of the program. So we know that endowed chair programs are really something you more often see in academia, but it's really taken hold here at Hoag. Our donors love these endowed chairs. They are very excited to participate. We started this in 2011, and we now have 19 endowed chairs at Hoag. One still needs to be filled. We've raised over $56 million to support endowed chairs. We spent $7.74 million If you recall, these chairs were funded to last into perpetuity, so we're only spending 5% a year. But we've also earned, so the program's growing and the funds are growing, we've earned over 27 million in investments from the endowed chairs. So every time we calculate that 5%, it's on a new, hopefully increased market numbers. So the program's growing and the funds are growing, and we're excited to have them. I want to introduce Robert Braithwaite, and obviously you all know Robert, but we're grateful that he's willing to spend time with us this evening to just share a couple of thoughts and really kick off this meeting before we hear from our physicians. So Robert, I'll turn the time over to you.
Thanks, Flynn. Thanks for the invite. It really is an honor to be here tonight, so thank you very much. Flynn asked me to make a couple of remarks about how important the Endowed Chair program is here at Hoag. And I remember when it started and there was this idea of creating endowed chairs here at Hoag, and it felt like such an academic center model, and we kind of wondered if it would really work at Hoag. And anyhow, it took off actually pretty well, and it has become one of the pinnacle programs within the foundation and here at Hoag. It really represents the best of medicine here at Hoag in many ways. But earlier today, I spent a little bit of time kind of going through some of the investments that have been made by virtue of the work that the shareholders, you all, have been doing. And I put them into broad categories. First and foremost, we've had many examples of physician recruitments that have happened, and physician talent that has been brought to the community. We've had a few around retention as well, which has been super important. We've got some great examples of new programs that have been started by virtue of the shareholders and the funds that they use. We've advanced clinical training, including fellowship programs, and started fellowship programs as a result of some of the funding that has come through the chair holders. We've done some innovation work, which is really exciting to see Hoag leading in that regard. We've acquired some important technologies and put those tools into use in our community for our patients. We funded access to care for some unfunded patients as well. In a couple of instances, we have some great examples of professional development, not only for physicians, but for the support staff that help make the whole healthcare system go. We funded some ancillary support positions through some of the shareholder funds. And we've created this, like I said, we've created some fellowship opportunities. The bottom line is when you take all these things together and really roll them up into one overall piece, I guess, impact, it's been tremendous. And the ones who benefit, obviously, are patients, because they're the beneficiaries of the investments that have been made, clearly, and their families. But more importantly, I think it's a tremendous source of pride here at Hoag. We have had a conversation multiple times around this notion of Hoag becoming a private-demic medical center, not a community hospital, but perhaps not a full academic hospital, and finding its place in between those two. And the Endowed Chair program is probably one of the ones that epitomizes that goal, or that desire to be a private-demic institution. I also had a little bit of time to go through and look at kind of where universities sit relative to endowed shareholders, and wondered, what is the potential? And obviously it's potential that grows over time as we get momentum. But just to give you a few of them, these are some more university type settings. But Michigan, up in Michigan, they have 245 endowed shareholders. Penn State has 208 endowed shareholders. And there's a whole list of them, but I think we're just at the beginning of what this can do for our community and for the physicians that choose to practice here at Hoag, and it's pretty exciting. And so we're a big fan. When we talk about this program, it always resonates with the donor community. It always resonates with the boards that oversee or govern Hoag and the foundation. And clearly, when you talk about it to the staff that are aware of the program, they also consider it a big source of pride. So we're excited to have it. We want to nurture it, want to develop it. We think what it does for the physicians as well is really helpful and enriching to them and their professional lives. And we would just like to see it and continue to grow. Flynn also asked me to talk a little bit about kind of where Hoag's going. And I don't, we say it all the time about this is probably the most challenging era in healthcare, and that is a truism today, for sure. You all know what Hoag is transitioning through. We often refer to the pandemic and kind of what that means to the whole healthcare system. But we're also in a place where Hoag's reestablishing itself as an independent institution again, which grants us tremendous latitude and nimbleness and autonomy, which we believe we need in order for our community to thrive and for Hoag to do its best work. And so as we approach hopefully the conclusion of that separation process, we do have some really big plans for Hoag and are actually executing on them right now. We did not share with you, although some of you have seen it, but we did not share with you tonight kind of the map of Hoag. But if you were to look at Hoag today relative to where we were in 2010, the landscape of Hoag has changed dramatically. And we're getting close to being, I would call it tip to tip north, the very far north of the Orange County border, as far as coverage all the way down to San Clemente, and then infilling it in between, at least along the coast. And those plans are ongoing, and we continue to make those investments and extend the reach of Hoag throughout all of Orange County, but particularly along the coast. And through some of the programs that you all lead, we have extended the reach well beyond the county lines and deep into California, and in some cases international reach, which is outstanding and exactly where Hoag wants to go and be seen as more of a national player, and in many cases an international player. So to that end, we're making some pretty sizable investments. You all know about the growth plan for Irvine and what that will do to several of our clinical services. In total, when all is said and done, that will top $1 billion of investment in that greater Irvine area. But as if that wasn't enough, it's pretty significant investment. We're also making health center investments, continue to put them in certain parts of the community where we can extend the Hoag reach and the Hoag brand. Early this year, we planted our first flag in San Clemente. I'm happy to report that flag, those practices that are down there with our primary care docs have thrived. They're doing exceptional. So much so that we felt very bullish, and last week the board of directors approved another small health center to be established in the Dana Point, Laguna Niguel community right there by Monarch Beach. And so Sandy Smith will be establishing that beachhead. We have a lease in place, and pretty soon here in the coming months, we'll have another flag planted in deep South Orange County to again bring Hoag services to that community. And that's not all. We've got lots of other geographic growth opportunities. Simultaneously, the board's really committed to the notion of innovation. There's some early work that's occurring at the board level around, hey, to be in academic medicine, and given the community that we live in a rich community from the perspective of there's lots of biotech companies in and around Irvine, we do have an opportunity to create an innovation and research center that can partner with some of those biotech firms and others, some national players within, certainly within Orange County, but perhaps the country as well. To that end, we're kind of modeling that after some of the concepts that you see up at Stanford, where they've got adjacent to the university that tech innovation hub, if you will, and there's some great medical technology companies that are spawning from some of the collaborative work that Stanford is doing with some of the tech startups. And we think we can do that at a smaller scale here in Orange County. No one's doing it, but it should add to the cachet and the brand of Hoag, and certainly allow our physicians to be on the forefront of many things that's both research as well as innovation in that space. And so there's a lot going on there. It's pretty exciting to watch and to see. And then there's a whole bunch of other things in the background that are we're working on to help make sure that what we do and the services that we provide really are durable. You all have heard about the Hoag Clinic, and that whole concept is there to ensure the viability of practices over the next 20, 30, 40 years, and create the infrastructure which our physicians can rely on when they need it and when they want it, and how they need or want to interface with it. And so a tremendous amount of investment is going into that infrastructure to make sure that we're capable of supporting our physician community exceptionally well. And a whole host of other things are occurring as well. I will tell you that recently, we just talked to our executive management team today. We landed 2 very important payer contracts, which will also change the landscape of Hoag. The first payer contract that we landed and finished this last week was with Anthem Blue Cross. They're our largest payer that we interface with here at Hoag. But what was important about that contract are 2 things. Number one, it's a 5-year contract, which is almost double what normal payer contracts are. Provides, again, the security and stability that our physicians need in the community, as well as Hoag, for sure. So it's wonderful in that regard. But more importantly, it gives us the ability to actually white label that product, the Blue Cross product, with Hoag's name. And so we will not do it for 2022. But we will start thinking about, or perhaps even planning, to offer in the Orange County community, perhaps as early as 2023, an insurance product backed up by Blue Cross, but it will bear the Hoag name on it. That is also true of another health plan, which we just concluded last week as well, called Alignment. They're Alignment Healthcare. They specialize in the Medicare space. And we're excited to partner with them. They have tremendous capabilities in working with the Medicare population. It's where they subspecialize. But they too were very interested in working with Hoag on a white label product that can be put into the marketplace, again, as early as 2022, but it'll probably be more like 2023 when we do that with them. And so, again, the face of Hoag is changing tremendously. How we interface and touch the community is going to change dramatically as well. And I think as we add all the various pieces and parts, Hoag at Home and more ambulatory sites and more new clinical programs, which you are all helping to develop, we believe that we're going to be able to really care for the community in a much more holistic way than we have historically done. So we're super excited, super motivated about it. We are getting a lot of national attention. I spent time earlier this week with the CEO of Scripps. It was fun to do it, and rather than be the smaller organization learning from the larger organization, it was just the opposite. Very impressed with what Hoag has been doing, and wanted to learn from Hoag. And it was a good moment for sure. We've got a lot of opportunities in that regard, but I think one of the things that has made us able to do that is, one, the significant investment that the community has made in Hoag, for sure. Certainly the clinical talent, which you all represent the pinnacle of that, but also the fact that we are smaller in size and far more nimble than big health systems or chains that are coming together and working towards kind of perhaps a standard. They would say a standard of care, but in many ways it's kind of the mediocrity, or just maybe a little bit above a mediocre level of care that they can scale. And anyhow, so I feel very fortunate to work here, to be part of this era, if you will. Just grateful for the opportunity to be here with you all tonight. And with that, Flynn, I think I'll stop and turn it back to you.
Thank you, Robert. And we do have some time if anyone does have a question for Robert, or comment, or anything from what he has said, or anything you want to add.
I would just, if I may, having seen the growth of the Endowed Chair program from its very beginning, say that it really has, I think, catapulted Hoag, and particularly around specialized services, to a whole new level. As Robert's point as to how we use endowed funds, he mentioned Scripps in his last few sentences. For instance, some of my neuro endowed chair funds just went to recruit a Scripps, an eminent Scripps neurologist to Hoag. Couldn't have been possible without those endowed funds. And this is a person who's going to bring with her over close to 1,000 patients from South County that have been going down to Scripps. They're now coming back to Hoag. Not to mention the elevation of our services in specialized neurology and partnership with Hoag Medical Group on top of that. That's one example, most recent example of how I've used those funds, and recruiting someone like Rob Lewis, who's now an endowed chair. And how cool is it? Maybe the next biggest thrill to getting an endowed chair is seeing one of your recruits get an endowed chair. So that kind of scaling, synergy, and exponential endowment, if you will, through the endowed chair program is so satisfying. Robert's exactly right. This does not happen. He mentioned those numbers at Michigan and Penn State. Correct me if I'm wrong, Robert, but that's the entire university. That's not just medical school.
Oh, you're right.
If you went to medical schools, we may rival some medical schools for the number of endowed chairs we have already.
Well, that's a great comment, BZ. I will tell you, just from having been at 3 other academic institutions, our endowed chair endowment amount is a larger amount. So our chairs start at a higher dollar amount, and our donors are willing to fund that amount. So it gives us more resources to spend and the things that you mentioned. Well, thank you for that comment. And as I mentioned at the onset, tonight's meeting is different than what we did the last time around, and that's because of the feedback that you gave us, the thoughts that you shared with us. And again, I want to thank Robert for being here and sharing, his thoughts and talking about the endowed chair program, but also just sharing what's on the horizon at Hoag. And it's all very exciting news. So tonight, what we're going to do is we have 3 presenters who are going to respond to the questions about use of funding and impact. And BZ talked a little bit about that with his endowed chair, but it's helpful, we feel, especially for some of you who are new endowed shareholders, to hear from others who've been holding these chairs for a little while and having them report out on some of the work that they're doing. So without further ado, I'm going to turn the time over to Teresa Conk, who's our Senior VP and Chief Clinical Institutes Officer, and she's going to introduce each of the presenters this evening. And also, we'll spend some time after each presentation in discussion. So, feel free to be ready to have questions or comments. We want to make this as interactive as possible. So, Teresa, I'll turn it over to you.
Great. Thank you, Flynn. Such an honor to be able to introduce our endowed chair speakers this evening, starting first with Dr. Bert Eisenberg, who holds the Grace E. Hoag Executive Medical Director Endowed Chair in the Hoag Family Cancer Institute. This particular endowed chair was one of the first endowed chairs that was established at Hoag. As Executive Medical Director of the Hoag Family Cancer Institute, Dr. Eisenberg is a visionary leader who has transformed and elevated the Institute, resulting in the Hoag Family Cancer Institute being ranked in the top 10% of cancer centers in the country. His visionary approach has advanced critical cancer initiatives, including the establishment of the Precision Oncology Program, our Phase 1 clinical trials program, and he has been essential in leading key impact recruits for the Cancer Institute, including our newest endowed chair this evening, Dr. Gary Uhlaner. And so picking up off of what BZ said, that has to be such an incredible honor and a source of pride to see one of the recruits that he had such a strong hand in bringing actually receiving his endowed chair this evening. Dr. Eisenberg has built very strong relationships with our donors and has earned his respect through all his tremendous work here at Hoag. And we're so grateful, Dr. Eisenberg. I will turn the time over to you.
Thank you, Teresa. Before I start, I think I'd like to acknowledge the privilege for in serving in the Grace E. Hoag Endowed Chair as a recipient over the last 7.5 years. It was certainly an important value added to my recruitment package as well. So can I have the next slide, please? So I thought I'd sort of start by telling you what my lessons learned were, my points of wisdom, perhaps. First of all, I think the important aspect here is to prioritize for the greatest impact with these chair funds, not just for now, but for the future as well. And I've learned that you got to keep something in reserve. So opportunities occur at the least expected times, and it's important to have some reserve to take advantage of those. And most importantly, we are the stewardship of these funds and are responsible for their use and their and our own program development. Next slide, please. So we have a strategic plan, and in most comprehensive NCI comprehensive cancer centers have a strategic plan, and these are the 4 pillars that I've used and have devoted some or most of my endowed chair funds towards over the last 7 years or so. And I can tell you that in addition to the clinical programs and the supportive services and the donor-supported nurse navigators, the impact of these pillars have really given us the opportunity to be in the top 10% ranked nationally by the U.S. News and World Report over the last 3 years. Next slide, please. So I'm going to first start out with physician recruitment, a very important aspect of the use of my endowed chair funds. These are the 3 physician leaders that have come to us through my funding partially. Dr. Michael Demur has been a terrific recruit, and he was brought here to develop and expand actually our precision medicine program. Has done a marvelous job in doing that. Dr. Dan Von Hoff is a world-renowned investigator and drug developer, and has been crucially important in expanding our relationships with sponsors and getting us access to new drugs for all of our investigators. And Dan is the recipient of the Margaret Larkin Chair in Developmental Therapeutics. And as you've already heard, Dr. Gary Ulaner came to us within the last year. It was a very important recruitment for our molecular imaging and diagnostics center, which also the endowed chairs have supported in funding. Gary brings an R01 grant to Hoag and the administrative capabilities of that grant. He also has 6 new clinical trials, including the first in the US trial for imaging in myeloma that has an antibody targeted to the CD38. A little aside, through Dan and Gary, we were able to get a contact at an important new sponsored relationship with a company called Fosplat. They brought us a new agent, which is actually an interesting molecule, an enhanced, an immunogenic cell death inducer. And Gary was selected because of his myeloma trial, he'll be part of that trial in phase 1. And Hoag should be able to get this very interesting study going. So these kind of things are differentiators for our program. Next slide, please. I've also used the Endowed chairs for Construct for a center of biomarker discovery. In this case, we're defining biomarkers as individual characterization of patients' cancer based on a discovery platform of cancer-specific molecular markers. And this is true for both circulatory as well as tumor-specific, where Dr. Demur and Dr. Braxton, who's a molecular pathologist, have received additional funding from our Innovators Council. And very shortly, we will have acquired some new technology, the IDILA platform, which basically is a PCR-based automated technology for cancer-related hotspot mutation identification. So we're going to be able to turn this over now in 24 hours at our own lab, and they're very interactive with both precision medicine and as well as the clinical trials program. Dr. Demur additionally got some funding from the Innovators Council to bring in a MALDI time of flight mass spectroscopy. So we're going to be in position to do some proteogenomics, which is rather exciting for an institution like Hoag to be able to get into that area. We now have panels of biomarkers that we're using, looking at things like minimal residual disease, homologous recombination deficiency, and immunoscore that we're using in our everyday practice. Next slide. So as I mentioned, developmental therapeutics in the phase 1 program, when I first arrived, we had about 3 trials in the Cancer Center. We now have somewhere between 85 and 90 active trials. About half of those are in the phase 1 space, which makes us a rather different or a differentiator in terms of community-based hospitals. Dan has brought a lot of new agents to us. And one recently is from Torre, which is a company that has given us a new molecule to look at a antibody called Caprin-1. Also, our cell therapy program is developing. We have several cell therapy trials, one in pancreas, which is just being completed, one that just started in triple-negative breast cancer, and a new one that's coming online, which is a memory cytokine enhanced PD-1 CAR NK cell that will soon be initiated at Hoag. Next slide. And lastly, a concept for a Center of Applied Genomic Technology. This has been ongoing with Mike and also Surat Darabi, who is a clinical scientist for and educator for genomics. Both have contributed significantly to this program. We are routinely reflex testing now over 3,000 tumors now in our data banks, both DNA, RNA, as well as soon proteins. And this also leads to an increase in our germline testing, up 60% over the last 3 years. With Surat's help, she is routinely attending tumor boards. We have a molecular tumor board now, which is very exciting over the last year. And about, in her expertise, we've identified about 40% or so additional recommendations beyond the commercial lab. So this provides us, again, with a very unique program, and the endowed chair funds were very much used for this program as well, and will continue to be in the future. So I'm open to any questions anybody has about the program or where we are, where we're going. Thank you.
Thank you, Dr. Eisenberg. Any questions or comments or just thoughts in general? Where there might be some, in the past, I know when we had met together in person, there were discussions about different cross collaboration or other opportunities, but just any thoughts from anyone? I know the group's not this quiet.
Everybody's on mute.
I had a question. I know you had mentioned that the endowed chair had helped you to recruit additional physician leaders. I was wondering if you'd be able to speak more to that, because at the Diabetes Center, obviously, we're smaller and a little bit, yeah, I'd love to add more leaders here. I guess I was curious to hear how that, what that process looked like for you.
Yeah, thanks. I think as was mentioned, you know, using the endowed chair funds for physician recruitment and retention is certainly critical for the program development. So we've had opportunities to identify needs within the program and the center, the cancer center. And with that, you know, we try to develop a profile of the type of physician we'd like to recruit, and then develop a recruitment package. So part of that recruitment package, whether it's initial salary support, whether it's getting new technologies and so forth, part of that package is always, you know, we look at the endowed chair funds as a potential, at least portion of the package. It's been very successful in that, you know, the ability then to be sort of nimble and be able to recruit docs and to be to meet our certain needs according to the strategies employed. So yeah, I think that's a really important use, and it's been one of the most enjoyable parts of my tenure here and the use of the funds is bringing in great new doctors and investigators to expand the program, and hopefully you'll have the same opportunities.
Thank you. Any other thoughts? Beezy, I know you've done this, and maybe some of you others have. Dr. Brooks, some other experiences where you've utilized funds to, I know in some cases even set up labs and other areas that would bring different physicians to the organization.
Yeah, so you know, it obviously depends on how much has spun off from the endowment for a given chair. I know Flynn's in the past been kiddingly critical of me for hoarding my endowed chair dollars, but the result of that hoarding is that you get a critical mass of dollars to be able to bring in a couple of people year to year or whatever. So that said, even with a small amount of dollars, for instance, when we recruited David Millett to be our program director, one of the, even though it was a small amount of money, a 5-figure number, we were able to use that endowment to bring David on as in a business development agreement, recognizing that David would then create a program once the business development developing epilepsy program reached a critical phase. And so certainly even a small, relatively small sum can bring in new folks, not for an endowed chair necessarily, but for a program directorship or towards a program directorship or a business development agreement, that kind of thing. So now there's a scale as to how much money you need to help recruit.
Is that helpful, Dr. Ron?
Yeah, very much so. Thank you.
You know, the interesting thing, and I know that Beezy alluded to this though, but if I'm looking on the screen, we have at least what, four of you who were part of that recruitment from endowed chairs who are now endowed chair holders. So we look at it, it's a if you build it, they will come type of mentality at the foundation. So we'll you bring them in, and we'll find the funds to help you know, for those high quality physicians. We'll get the endowed chairs. I just committed to something, and I noticed it's being recorded, so I need to be very careful what I say. Any other questions or thoughts before we move on to the next presentation?
I was just thinking that, Dr. Silverstein, you used some of your endowed chair funds when we were at a critical juncture in the breast center and needed to be able to support keeping on Jeff Shell for the work that he did in, in the software for MagView. And, sometimes it's just supporting what otherwise would not be possible. And then we even do some cross-pollination where if there's a critical individual that is going to bring value to different institutes, we'll contribute. BZ and I have had where he'll contribute half and I'll contribute half from my funds. So a lot of it is collaboration and just working towards finding something that's going to add value to the entire organization and doing it in whatever way you can. Bert uses the word nimble and I use the word scrappy, and other people try to be more diplomatic and call it collaborative, but there's a lot that's possible, even just with a little bit, and especially if you make your needs, if you share your needs, and that's kind of the purpose of even this meeting is for us to better understand what your vision is for the diabetes center and what you need to make it or to fulfill that, and then we'll look to help.
Yeah, I think it's especially important when we put together a package that's sort of cross programs or cross disciplines. And we've had occasions in the past where everybody sort of gets together and we discuss an important recruitment or important programmatic addition that it doesn't necessarily have to be through one institute. It could be a strategic recruitment over several institutes.
Thank you. Great comments, everyone. And just looking at the time, we're going to move now to our second presentation, and I'll turn the time back over to Teresa to introduce our presenter.
Thank you, Flynn. I would like to now introduce Dr. Allison M. Brooks, who is the first recipient of the Ginny Uberath Executive Medical Director Endowed Chair in our Women's Health Institute. The chair was established in 2015. After 21 years as an OBGYN, Dr. Brooks decided to extend her commitment as a Hoag leader to providing excellent health care for women by developing programs for maternal mental health, maternal child health, breast health, integrated wellness, and many other programs that she's put her fingerprints on. As you know her, she is warm, funny, and relatable, and understands the importance of providing high quality care to all women in our community. She is an advocate for women's health, and she works tirelessly to ensure that all women have access to critical resources and care. As part of her passion, she serves on the board of directors for both Moms Orange County and the SOS Clinic. I work closely with Dr. Brooks, and it's always a pleasure and a lot of fun. So Dr. Brooks, I'll turn this over to you.
Thanks, Teresa. All right, next slide. So since inception, when I was surprised by Flynn and his team and Robert at a breakfast at the Island Hotel where the Uberaths announced that they were establishing an endowed chair for the Women's Health Institute. After, my shoe fell off and my blood pressure dropped and we all were really excited about what that would mean for women's health, the very first question that Ginny asked is how will you use these funds? And fortunately, about, a month earlier, BZ had called me in the middle of the afternoon and he said, I have a present. Can you come over? And I said, sure. So that had never happened, but I went over to his office, and in his office was this amazing Venezuelan woman who was brilliant and was involved in a career that I had never heard of. She was a reproductive psychiatrist. And he said, she's interested in coming here, and this is what reproductive psychiatry does. And anyway, that was kind of all she wrote. So fast forward a month when we're sitting there at breakfast, what are we going to do? And I immediately thought, we're going to fill an unmet need here in our community. And that is by finding a specialized psychiatrist who can help our new moms, can help women as they transition through the perimenopause and the menopause, that can help our adolescents and young adults as they're going through some significant hormonal changes. And that kind of inspired me following that time to say, or make that commitment, that endowed chair funds would be used to fill gaps that were identified by us asking women what their unmet needs were. And also by just having been in practice for 21 years, understanding how patients would call me and ask, how can I get in with so-and-so, or I'm having this life problem or trouble, and it would take me 2 or 3 hours to find the right resources to help that individual. So the thought was, let's use the Ginny U. Baroth Endowed Chair funds to fill gaps and meet unmet needs for women in our community. Next slide. So these 3 amazing reproductive psychiatrists have been part of that package. So Patty DeMarco was the original, and we would not have been able to retain her again without having that support and collaboration from the Neurosciences Institute. Following Patty DeMarco, who unfortunately was a COVID casualty because there was some challenges with being a mom and a wife of a physician, and having serious concerns about face-to-face interactions with patients, and not feeling that she wanted to participate in the virtual Zoom conferencing. She helped us find another amazing individual who was Mercedes Spunar to fill that gap. And so the reason I share that story is that when you recruit someone and you use funds and they relate those funds to an individual that has empowered the endowed chair, like the UBROS, they feel a sense of loyalty to the organization and to that donor that makes them, despite what the circumstances are, loyal and committed to continuing that program. So we take pride in recruiting people that start programs that will exist long after maybe that individual is still here. So Mercedes then had a great opportunity, and she left to go back east, and we brought in Sarah Kaufman, who is actually a reproductive and forensic psychiatrist who is just doing an amazing job, because COVID has essentially, if not doubled, tripled the need for our postpartum women to have access to a team of mental and behavioral health specialists to address their perinatal mood and anxiety disorders. So we feel very, very privileged to have this type of expertise, and we would not have it without philanthropic funds. And so it's not only a reproductive psychiatrist, it's a maternal mental health program, and it's one that has sustainability due to that commitment over time. Next slide.
Also, Nelson, if I can interject, it also
Sure.
speaks to what you mentioned earlier. The chairs, the endowed chairs, the institutes are not silos. They collaboration, or what was the word you used? Scrappiness.
Yes.
Is a family affair.
Right. Exactly. So the other kind of, you talk about identifying unmet needs and filling gaps. Well, we were at an event, a local women's event, and Salpi Salibian, who runs our Hope for Her Center for Wellness, happened to see Anusha Wijayakumar up on a podium giving a talk on meditation and mindfulness. And, she's a Sri Lankan woman with a British accent who everyone she has them at hello. But what we were able to do is, again, use philanthropic funds to establish a kind of a program development agreement with her to help us mainstream meditation and mindfulness in our Center for Wellness. And it went beyond our wildest dreams. Initially she's completing an activity log of some of the support groups that she's leading or classes that she's leading or talks that she's giving. And now she has been, her services have been requested by businesses in our community, Goldman Sachs. They want her to come and speak to 30 of their executives about how meditation and mindfulness can reduce their stress and create an improved culture within their organization. The Addiction Medicine Center has made requests for her. She goes to cancer events, as well as with Komen and Living Beyond Breast Cancer. So everywhere she goes, she tells the story of her relationship and association and program development agreement with Hoag. And so she puts us on a broader map. And most recently, CBS and Adam Yamaguchi actually came out to film her and film the Center for Wellness and the team of kind of mental health experts that are there to try to decolonize yoga and meditation and mindfulness. And that's going to be airing in October. So the point there is that oftentimes, there's things that we can think out of the box of how we might use endowed chair funds to bring something to our community that might not otherwise not have been available. Next slide. So we talk about people and we talk about programs, but also about innovative technologies. Now, is an app a technology? Is it really that innovative? Well, for us, the Pacify app was very innovative because the unmet need is that women don't just breastfeed between 9 a.m. and 4:30, which are the hours of our OB education and lactation clinic. And one of our pediatricians came to us and said, my patients are giving up breastfeeding because they can't get the support that they need in a timely fashion. And I heard about this special application that's working really well. It was developed back in Tennessee. Would you be interested? Well, yes, we were very interested, but it comes at a pretty penny. But when we think that we're serving or delivering, now almost 7,500 women a year that are providing nourishment and respite and love and nurturing their newborns, we wanted to be able to offer that 24 hours a day. So with this app, every patient that delivers at Hoag gets 30-second to 1-minute access to a lactation consultant. And we get amazing feedback. I think now we have over 2,200 users, and they have access to this application and this virtual lactation support for up to a year after they deliver. And we chose a year because it was not only part of the package, but the World Health Organization recommends breastfeeding for that period of time. We've also, I mentioned the nurture. I'm going to let Rob Lewis go into that in more detail, but again, partnering with other endowed chairs in areas of passion or innovation. We developed the Nurture VR application with the intent of providing 4th trimester support and bonding and lactation support, as well as an introduction to meditation and mindfulness for stress management. And that was in part funded through the endowed chair. The final slide, I wanted to bring up, and not belabor it, but one of the challenges of the endowed chair program is that depending on the size of the endowed chair, the corpus, you can have a very significant, annual amount that you can either hoard like BZ does, or you can spend. But the expenditures cannot be willy-nilly, and they can't be what we dream up and during the night or think about in the shower. They really need to be aligned with the organizational strategies and goals. And they need to be vetted through our senior leadership and our board. So not so much for some of the smaller items, but when you're looking to start a center like Bert's doing, or recruit a certain individual that is going to have need some sustainable funds over a longer time period, it really does need to be aligned with the goals and the strategies of the organization and not done in a vacuum. So that's something that you kind of learn over time, and it's probably worth paying attention to earlier on in your endowed chair tenure than later. I think that's it. And I'll take any questions if you have any.
All right, are there any thoughts or questions or other discussion from anyone? I like the technology component. Any others utilizing endowed chair funds for technology? I know, Rob, you're going to talk about that. Everybody's quiet.
You know, I might add that, and Allison, I know that you're aware of this too, but, you know, we like to look at programmatic goals and institutional goals to sort of differentiate Hogue, because it is a differentiator. Hogue itself is branded. And so when I do that, I sort of think about what sort of innovation and new development in terms of programs might propel the Hogue brand and the name of Hogue into different areas that would be advantageous for recognition. And I know that you have tried to do that as well with your funds, especially in growth in Irvine and so forth.
Mel, do you want to share what you've done in some of the technology? I mean, I'm just thinking even MagView or some of the support of what, you know, January's efforts or.
Well, the breast program's goals have always been to support that program and make it the biggest and best in Orange County. And currently, we see about 900 new breast cancer cases a year. Part of my endowed funds go to support a navigator. And you say, wow, why do you do that? And the key is, if you don't navigate them and get them in the front door, so to speak, they go elsewhere. So that we have a navigator who sees every patient and tries to make their referral from one doctor to another effortless. And if you do that and they walk out and all their appointments are made and life is simple, they stay and they don't feel compelled to necessarily look elsewhere. So one of our goals has been to, you know, support or to decrease out migration and to have greater in-migration from other places. So we've spent money on that. And the breast program is very technologic. We have all kinds of new imaging to, you know, to help find cancers earlier. Every machine is, every mammo machine is now a Tomo mammo machine. There's brand new MRI technology in the breast center, new ultrasound technology. And it's all integrated, new methods of biopsying. And I'm not sure if that's what you wanted, but.
Yeah, no, I mean, I think those are great examples of things that we would not otherwise have. And certainly, even if we had one, we wouldn't have 6 or have one at every breast center. So, yeah, and again, I use that term, it's like mainstreaming something, making the best what we offer as standard fare and not something out of the usual. Thanks, Mel.
Thank you.
Any other thoughts or questions? Well, let's move to our final presenter.
Right, our final presenter, our final presenter this evening is Dr. Rob Lewis, who holds the Empower 360 Endowed Chair in Skull-Base and Minimally Invasive Surgery that was established in 2019. This particular endowed chair is the first chair at Hogue that is funded by an organization and not by an individual. Dr. Lewis serves as the program director of the Skull-Base and Pituitary Tumor Program at the Pickup Neurosciences Institute. He has led the development and implementation of virtual and augmented reality technology and leads the widespread implementation of VR and AR across each of the institutes. Under his guidance, the Pickup Family Neurosciences Institute has become the highest volume center for augmented reality in neurosurgery within the United States. If you know Rob, he is energetic, and that's an understatement, affable, and has a love for what he does that truly translates to the care that he provides to his patients and the trust that he develops with them. So Rob, I'll turn the time over to you.
Thank you, Teresa, and thanks for the opportunity to share tonight. I didn't realize until tonight I'm the newbie to the presenting group tonight. I got 2 executive medical directors and then me. I hope that what I have to share is interesting, and yeah, I'm really excited about the work that we've been able to do so far. Next slide, please. So just a little bit about the background of the mission. You know, we're as endowed chairs, we're kind of we're entrusted to be stewards of the funds from which the organization or the individual that gave to them and live up to the intentions of those funds. So the Empower 360 Foundation was established specifically to provide access to the most advanced virtual and augmented reality medical technologies, regardless of socioeconomic status. Next slide, please. This is established by people and patients who this technology had affected their lives. And so this is just a quote from one of the patients whose little boy whose life was saved by virtual reality planning for complex brain surgery. And this is his dad saying, if this technology wasn't available, our child wouldn't be here. Because only through using the VR were they able to see, you know, the complexity of the problem, and the surgeon was able to diagnose and treat it effectively. So this is just a little bit of an introduction to why this technology is so powerful and why this organization was established and the gift to Hoag was given. So the next slide, please. So as part of kind of the, you know, overview high level plan for using these funds to the best of my ability and to get the most out of them, I kind of developed a strategy of looking at, you know, there's lots of technologies and opportunities out there in both virtual and augmented reality. So I kind of developed a 3-tier system looking at how to investigate new opportunities and put them into practice. And so I use these terms: deploy, which is kind of putting into practice technologies which are already well established with a solid research base. I use the example of virtual reality simulation for surgery. There's numerous studies supporting this, as well as using virtual reality to treat acute and chronic pain. There are more than 500 published clinical trials demonstrating the efficacy of VR for the treatment of acute and chronic pain. And yet it isn't still mainstream practice to do it, even though there's multiple trials showing the opioid sparing effects of this technology. So one of the top level goal is to put these technologies into practice in order to decrease, for example, opiate consumption, or to enhance preparation for surgery. Another one is to perform research and to support studies that can further demonstrate the efficacy of techniques and technologies which need a little more robust research backing in order to become mainstream. And on the bottom tier is to develop new technologies which meet unmet clinical needs, as Allison had mentioned. And I'm going to talk about an example of each of these as what we've done over the last few years. So next slide, please. So in the developed category, one of these is augmented reality system, which we have developed at Hoag from scratch, from a concept, a light bulb moment, to FDA clearance and commercialization. We did this in less than 22 months. It normally takes 5 to 7 years to take a technology from an idea stage to a prototype to testing and validation and publishing studies, and working nimbly with multiple individuals in the Hoag organization as well as outside. We were able to do this and get the product through FDA clearance, and now have done at Hoag more than 1,000 cases with this technology. So this technology was born at Hoag from idea and has subsequently been put into practice by several of our neurosurgeons, and is expanding from augmented reality for brain surgery to include spine surgery and many others beyond that in the years to come. Next slide, please. So this is just an example of how we use this technology in surgery. On the left is an image, an unaided image through the microscope at 10x magnification of a tumor involving the optic nerve and carotid artery. As you can see on the left image, it's really difficult to see anything. You see a blob of what looks like all tumor. However, when you turn the AR on, which requires the tap of a foot pedal, you can see the left optic nerve, LON, the right optic nerve, and the carotid artery running through what otherwise just looks like tumor. So the ability to see these structures in real time during surgery is ultimately enables us to get more complete tumor resections and protect these critical structures. You know, as with many areas, you know, once the structure is injured, the optic nerve gets cut, it cannot be repaired. I can sew it back together all I want. It doesn't function ever again. So being able to visualize them is the first step in being able to protect them. So allowing surgeons to see what they cannot see. And again, we're taking this from neurosurgery and expanding it into other specialties as well. Next slide, please. An example in the research tier is a study we were involved with for using virtual reality for chronic pain. As you guys may know, the number one reason for people to seek healthcare, any people, is pregnancy. The number two reason is back pain. So everyone probably has low back pain at some point in their life. This was a study that was a virtual reality system that was developed for at-home use for chronic back pain. And this was an 8-week trial. These are the results that we saw. 42% reduction in pain intensity for the control for the research group, almost 50% reduction in activity interference, also positive impacts on sleep interference, mood interference, and stress reduction. We have published 3 follow-up studies from this initial study and are now getting to the 6-month point. And many of these benefits have held even after the virtual reality treatment has been discontinued. So it's introducing the skills of mindfulness, introducing what's called pain neuroscience education. So teaching the patients about their pain helps them be able to better recognize and control it. So this is an example of how being involved in the research tier. So we had develop, research, and then deploy is kind of the bigger scale of putting them into practice. So next slide, please. This one is showing over time that's that same study showing in orange the virtual reality system. In blue was actually a sham VR arm. So they developed a system that they're still in the virtual reality headset, but they have a sham experience and showing a therapeutic benefit with statistical significance, which is necessary, again, to get through the FDA. So the FDA doesn't just want a benefit, they want benefit over control. So it's unlike a drug where you can have a placebo, having the technology, a sham arm of technology can be relatively difficult. So this is something we've worked to create. And again, showing prolonged benefit in patients with chronic pain. Ultimately with the goal of decreasing opiate consumption, which we know results in somewhere around 100,000 deaths a year from opioid overdose now. So anywhere we can make a dent, we're happy to be leading the way in this. And Hoag has, as a result of this development and research efforts, become one of the, if not the national leader in this space, including eclipsing even academic centers such as Stanford and drawing a lot of national and international attention to the work that we're doing. Next slide, please. And finally, closer to home, this is an example of the deploy tier, actually putting the technology into use for our own patients and, in fact, ultimately for our own nurses. This was where we took the virtual reality headsets to the floors during COVID, and patients that were isolated during COVID. More than 1,000 patients were enrolled in this program. And actually, we put some nurses that were furloughed back to work running this program and showing an average reduction in pain of 3 points on the VAS scale of 10. Now, just for reference, the average reduction in pain from a 25 microgram dose of fentanyl is also 3 points. So if you can get the same reduction as a small dose of fentanyl with the VR, a dose of VR, then we really, again, are working towards achieving that goal. And this was just one quote at the bottom that was saying that with the use of VR, he was able to reduce his pain medication by half. And this was a chronic opioid user. So again, putting these, taking the principles, developing them and putting them into practice is kind of the way that I've kind of tiered it out as far as the work that we're doing. Next slide, please. One of the other things that we've worked with philanthropic support to put on is next week, actually next Friday, is going to be our second annual, the first one was last year, second annual Advances in Virtual Reality conference. This is a community-based conference targeting local physicians, nurses, as well as community members, interested patients. Last year, we had more than 1,000 views of our conference. And so far this year, we have more than double the number of registrations that we had for last year. So this is an opportunity to bring in both experts from around the world, as well as experts from Hoag. So one of the goals this year with the conference was to highlight some of the work that is being done across the Hoag Institutes involving virtual and augmented reality. So for example, we're going to be hosting Dr. Jeff Bassett this year, who's using VR and AR in his prostate cancer surgery work. We're going to be having Dr. Lauren Bennett, who's using virtual reality for cognitive evaluations and training. We're going to be having Dr. Vic Mehta, who's using it for epilepsy research and surgical planning. So it really is, again, like as Dr. Brooks had mentioned and Dr. Eisenberg, an opportunity to work collaboratively with other institutes and programs to find ways that we can accomplish the goals of raising the standard of care at Hoag. Next slide, please. So all of this helps Hoag in ways that we've already talked about. I mean, on the surgery aspect, working towards less invasive surgeries. On the national ranking scale, becoming nationally renowned for developing new technologies is something that raises the level of the institution, both the institute as well as the organization. And then other benefits that we've talked about, including increased patient retention, physician recruitment alignment, and bringing new benefactors in. So one of the things that we do regularly is to tours of our advanced integrated neurosurgical operating rooms in order to bring new benefactors and new potential donors in to become closer aligned with Hoag. Next slide, please. We've got some future projects in the pipeline, just kind of what's next in line. We've actually developed now an augmented reality product for spine surgery as well. There are other projects, including with orthopedics and cancer, which we're kind of in the development and planning stages as well. Next slide, please. And finally, the most exciting bit for me at the moment is just now I'm kicking myself because I put a rendering of this, but we actually now, just as of today, our virtual and augmented reality laboratory in the Neurosciences Institute is open. This is called the Center for Advanced Visualization and Immersive Therapeutics. What it is a 3 different components. One is a 6-suite experiential theater where surgeons and physicians from all the institutes can bring their families to do 3D virtual reality renderings of their plan for breast cancer surgery or prostate cancer surgery or their lung tumor resection. Another one of the rooms is specifically a virtual reality immersive treatment room where patients can come and experience VR and AR treatments for things like cognitive disorders and phobias and PTSD. And finally, there is a innovation development lab where we're going to be working side by side with physicians and engineers in order to build new technologies and engineer the next generation of both surgical visualization technologies as well as VR and AR treatments. So this is a space that's open for all of physicians to come and use and collaborate. And part of my endowed chair funds has been used to bring on an employee, part-time employee, to manage the space, to coordinate its use, and to help my colleagues to be able to utilize it as well. So anyone that's interested in this, just send me an email and I can connect you with Janine, who's the manager, the clinical VR programs manager, and we can have anyone in for a demo or tour at any time if you guys are interested in working together with us on this technology. So I think that's my last slide. So, we're all of us proud of the work that we're doing at Hoag, and I didn't get a chance to talk about Nurture VR. Allison and I, this is an area where we worked together with the Neuroscience Institute and the Women's Institute to create a new program, a 22-week program in virtual reality to educate and empower women throughout the 3rd trimester and, quote, 4th trimester, and with the ultimate goal of hoping to decrease what is now a significantly increased rate of peripartum mood and anxiety disorders. So, one of my passions is beyond, surgery and the technology to do it is just kind of making a difference in other aspects, and particularly in behavioral health and mental health. And this is where I think virtual and augmented reality have a lot of power to do that. So there's unlimited opportunities for collaboration, and I look forward to working with many of you in the years to come. Thank you.
Thank you, Rob. Thank you, everyone. Any lot of great ideas around technology, around education, research. Any thoughts or additional comments? I think we're going to try to unmute all of you so we can have any discussion or questions. Any thoughts or questions? I know this is not that quiet of a group, so worked with all of you. Or anything you want to add to the discussion? I'm going to ask a question for all of you, not completely related to what Rob presented, but one of the ideas that we have when we come back together, and we're trying to hold 3 of these a year, and we know they're a lot more effective in person, but want to get your thoughts and maybe even your comfort level, because what we would have loved to do tonight if this was in person, for those donors who are still with us or their family members. So for example, with Dr. Eisenberg and Dr. Lewis and Dr. Brooks, we would have invited, you know, a Ginny Uberoth or a Vicky Booth, or, you know, maybe some of the officials, you know, the executives from the company that funds Empower 360, or Chuck and Melinda Smith. What's your comfort level with having them sit in on these meetings and hear these presentations?
Sure, why not?
So I think it's a great stewardship tool. It's good to a certain extent, like we're doing tonight, hold us all accountable and really show the work that's being done, but also just show the depth and the breadth of this program. I think is could be of some value. So would love to get your feedback. BZ, go ahead, BZ.
I think it's a good idea, Flynn. I would like to, though, remind ourselves of one of the organizational foundations we laid for the endowed chairs is a venue where we just don't, we have too many of those at Hoag, where we just provide didactic lectures and not enough discussion of common challenges, of potential ideas, and really have this be the basis, this group of endowed chairs be the basis of what potentially could become a Hoag faculty, like a Hoag faculty strategy like exists at Cedars, for instance. Understanding that the Cedars faculty is really an employment model faculty. That said, Privatemics continues to ring in my ears. Thank you, Jamie. And have this group be a mentorship group for new incoming endowed chairs, as we're doing, but also each other, and to help us struggle with some of the challenges that we started to discuss in the earlier days of the endowed chair program. I just don't want to see this devolve into simply presentations and a few comments around the presentations.
Good, thank you. Other thoughts, comments?
This is Abe. I have a comment about, is there a maybe a technology company we could partner up with to have almost like a IT focused endowed chair, you know, which can help us with, you know, stuff like natural language processing, medical records, something which would help our whole enterprise in a way that it would benefit every person who's involved with our whole enterprise.
So just so I understand, you're looking for funding for those types of resources.
Yeah, I mean, and maybe, you know, we partner with a technology company and get them to, you know, do endowment through, you know, that aspect, you know,
No, no,
It's just a
think
thought.
yeah, and I don't think it has to be an endowed chair as much as it could just be funding for.
Correct, correct.
No, I think that's a great idea, and we're certainly happy to work with you and others on that. Other questions or thoughts or? I do want to, so the idea is to make sure we are sharing, so BZ to your point, not trying to create just lectures, but we are trying to share information because I think it is helping to mentor others, especially those who are new to this, where they see ideas, where there may be collaboration. We know this obviously works better in person. It's a little bit more interactive, and what was shared with me even this evening is, some of the side conversations when we're in person are very effective. But we will reach out to you, and we do want to rotate, so we're hearing from everybody, in some very short presentations, but we'll have discussions. And I want to thank everybody our three presenters tonight, and also Robert and Teresa for being here with us today. We do have 3 dates for next year that we will send out to you, and just make sure you have that on your calendar. And again, we're hoping that even by the next meeting, we can do something in person, and I think that'll be much more beneficial. Any other thoughts or comments or suggestions? We've had some great suggestions tonight. Any other thoughts as to what you would like to see as part of these meetings before we wrap up? Allison, I think we lost your audio, so I don't know if you're muted or we just lost your. Yeah, we may have lost your computer audio. Robert, any thoughts from you?
No, thank you, Flynn, for hosting.
No, thank you. And thank you, everyone. And thank you for your time this evening. And a special thank you to my events team, who does such a great job. I will tell you the one thing we found out, that these events aren't any easier than in-person events. Maybe different logistics, but if you come down to the foundation, we've taken our boardroom and it's like a big control center that you might not quite see at NASA, but it rivals that. So special thank you to Deb McCune for coordinating this, and Dana Grant and all the events team. And hopefully you all got your little nourishing boxes. We won't talk to Dipti about any of the heart value or Dr. Caffarelli, but there's still some health components to it. And again, welcome Dr. Karamardian and Dr. Ulaner as our two newest endowed shareholders. Thank you for all that you do. You make our job so much easier at the foundation with the great work and great care and the research and all the innovative technology. So thank you so much. And we will see you all before January, but January 26th is the next date, but we'll get those dates out to you.
Hello.
And if you have any ideas in the
Hey, how are
meantime,
you?
send them our way. So thank you so much, everyone.
Thank
Have a
you.
good night.
Thanks, everyone.